So moving forward and discussing assisting in urology. With urology, it would be no different. Our patient would come in with an initial chief complaint, and it would be our job to qualify that patient's chief complaint. So the chief complaints would generally be centered around the urinary tract. And so we would ask questions about urination. Has the patient had any changes in the way that they urinate? Do they have any pain or discomfort with urination? Are they suffering from lack of bladder control, which is called incontinence? All of those would be great qualifying questions for a chief complaint in which we would document. And if the patient has zero complaints that relate to any of these questions, we could at least document that we did ask and that they have zero complaints. Now, once the provider reaches the patient, they're going to go through the physical exam, and they're going to use palpation and inspection in a way to be able to evaluate the patient. The provider may go through and palpate the kidneys and the bladder and do an overall visual examination of the external genitalia and the health of it. The groin is examined for a hernia. And for our men over the age of 40, the prostate gland is examined. And that's done by a digital insertion that's inserted into the rectum. Now, we would, just like we would educate our female patients on self-breast exams, we want to make sure that we're doing the exact same thing for our male patients when it comes to testicular exams. And so we would provide patient education to our male patients as well on how to regularly examine their testicles. Here are some common diagnostic tests and procedures for urology. And the first one there is pyelography. And pyelography is used to diagnose renal disorders. This is an X-ray of the kidneys, and we use what's called a contrast agent. It's an iodine-based dye. That dye allows for the kidneys to be illuminated, makes it a lot easier for the provider to be able to see exactly what's causing the problems. There are urine tests, tons of urine tests done in urology. It's actually considered the most commonly ordered test. It would be done in the chemical form, which we would use our chemical reagent strip test. That is something that is within our scope of practice. And if the provider needed to go further, they have the ability to take that urine sample, create a microscopic slide, and evaluate it underneath the microscope. Blood testing could occur. There are also lab smears, and that's when a slide is created. Smears are done to diagnose infections. And then the last one would be a semen analysis. And the semen analysis could be done for different reasons, but usually it's done to be able to determine the fertility of the male or evaluate the success of a vasectomy that has already occurred. Finishing up with some of the common disorders, diseases and disorders that have to do with OBGYN and urology. We have the ectopic pregnancy. And the ectopic pregnancy, this is a fertilized egg that doesn't have the ability to move past the fallopian tube. So it embeds itself into the fallopian tube and it starts implantation there, which is not where that should occur. Fibrocystic breast disease, these are fluid-filled cysts or nodules within the breast. They are benign, and benign means that they don't have the cancerous characteristics. And this is another good takeaway as to why it's important to educate our women on doing self-breast exams so that if they do feel these benign fluid-filled cysts, they know that these are normal for their body and it's not going to cause them a reason to be concerned. Going down, we have ovarian cysts. Ovarian cysts are sacs or of fluid, or they can be semi-solid material, and they're usually benign. Terms here that have to do with the menstrual cycle, we have amenorrhea, dysmenorrhea, menorrhagia, and metrorrhagia. The absence of menstruation, painful menstruation, dys is painful. Menorrhagia, rhagia is heavy or prolonged, and metrorrhagia is abnormal bleeding. And then impotence. Impotence is the inability to achieve or maintain an erection. Kidney stones here, nephrolithiasis is the clinical term for that. And kidney stones, chemical substances in the urine that form crystals in the kidneys, the ureter, or the bladder, and also the renal calculi. And remember, when we're referencing the urinary tract, that's anything within inside the urinary tract. So that could be the kidneys, the ureter, as well as the bladder. Kidney stones start usually within the kidneys. And the unfortunate thing is they need to make their way outside of the body. So kidney stones or nephrolithiasis has to travel from the kidneys through the ureters into the bladder, through the urethra. So they have quite a journey.